Q&A 16 is about SI joint pain. So someone wrote in and said that they have SI joint pain when they sleep and when they are walking. All right, so I wanted to talk about this a little bit. But the first thing I want to recommend is getting a good assessment by a physical therapist so that you can figure out what's causing that SI joint to kind of act up. Because we have muscular influences that surround the SI joint, the sacroiliac joint, all right? So this is our SI joint. So it's right here where our sacrum joins our big pelvis muscles. Now, you have all these muscles around it that help to control how those joints move, and they have little bits of movement. All right, now what we want to think about is what position your pelvis is in. So let's kind of work through a couple of things that we can try that might go ahead and give you a little help. So the first thing I think about when someone has SI joint pain when they're sleeping is their pelvis able to move down to the side? All right, so is their leg, when their leg hangs down, is their leg able to adduct? Okay, so what I mean by that is their leg able to go into adduction? So think about that. When you lie on your side and you're trying to sleep and your leg comes down, if your leg can't go into adduction, then you're going to be pulling more on your pelvis, which is in turn going to be pulling more on your SI joint. Right? Then the other part of side sleeping has a compressive effect on the pelvis from the weight of sleeping, and so that can also cause a little bit of irritation if you have tightness in here. Now, what I want to look at for walking and even sleeping, because sometimes we have aches that extend into the night. All right, but what I want to look at for walking is, are you in an anterior pelvic tilt? So when we think about an anterior pelvic tilt, very easy, my body loves to go into an anterior pelvic tilt. So when we think about an anterior pelvic tilt, that's a spilling forward of the pelvis. That locks or makes tighter the SI joints. So our SI joints have less movement or less play or less give in them when we are in that anterior pelvic tilt. When we are in a posterior pelvic tilt, it unlocks the SI joints, allows for a little bit more micro movements in there. And so if you tend to be somebody that is kind of locked in an anterior pelvic tilt, has lost adduction strength, then you're going to be a lot more likely to have achy SI joints that cause you issues with walking and with sleeping. So what I would focus on, I did a Form Friday a couple weeks ago on Hamstring Bridge. That Hamstring Bridge is going to help unlock that SI joint and help allow it to move. All right, it's going to help pull you out of an anterior pelvic tilt. So check that out. We'll link that to stories, or you can just scroll down and find the Form Friday Hamstring Bridge. So I would try that in bed at night before falling asleep, and I would do that during the day before you go out for your walk, and let's see if we can kind of reset the system a little bit. The other thing I would look for is side-to-side differences. All right, what's happening with the iliacus? It's a major hip flexor muscle, stabilizer of the pelvis. What's happening with your glute medius? What's happening with your adductors? So we have all these amazing muscles that are surrounding the SI joint, and we want to take a look at how those muscles are influencing that joint. The other thing I'm going to take a look at is what's happening with your abs. Are you getting even firing? So sometimes I'll see more of a rectus dominant pattern on one side and then more of maybe an internal oblique pattern on the other side. So you can imagine how the different ways the abdominals are pulling on the pelvis, if we have more of a dominant pattern of one on one side than the other, and then that influences this SI joint, because this SI joint here is where all the stress from our lower body gets transferred into our upper body, and all the stress from our upper body gets transferred into our lower body. So you can imagine how much these poor little joints have to sustain, but also how incredible is that? That these are the points that connect our upper body to our lower body. And so that's why making sure all those muscles that surround it are happy, are showing up like they should, and are showing up fairly evenly. Nobody's perfectly symmetrical, okay? But they're showing up evenly enough that it keeps your body happy. All right, so go ahead and take a closer look at that and see if that doesn't help with a little bit with your SI issues.